All right, welcome to the Human Services Committee meeting for what is today, March 10th. It's 9-ish. I'm gonna hand this over to Commissioner Winnie.
Thank you. First on the agenda, I'd like to request a resolution to declare April Child Abuse Prevention Month. And wheels and signs on that. Second.
Okay. Any comments? I think we should do this. Move to a roll call vote.
Martini.
Aye.
Bazile.
Yes.
Broccoli absent. Mendez.
Yes.
Clapperton absent.
Okay, hearing no no's or abstentions, the motion passes. I should probably ask, we have quorum, yes? Okay. I thought we did, but
So the next is a resolution to amend the opportunities for Otsego housing contract. When I spoke to our purchasing agent, they've been charging per person at the shelter and said it needs to be a room rate for different rooms.
is there,
For, oh,
we need to get it.
yeah, yes. So moved.
Second.
Jill.
At hotels or at
At the
the
shelter.
shelter? Oh, okay, so like a family rate, basically.
Right.
Okay,
So the top rate is $300 a night.
okay.
That's funded by Family Assistance, it's all federal. And when they did the calculations, Cheryl did the calculations comparing if we had done this last year, and it was actually less money
Okay.
doing it that way. By about 20,000.
Dan Hammer doing his job.
There's one other revision. Well, they're requesting that we pay for absent days at the shelter because, okay, so if a family goes to visit relatives for
Mhm.
Christmas, PA guidelines require them to reapply for PA, so end shelter and then reapply.
What's
And it's only
PA?
for a couple, public assistant.
Gotcha.
So, which is a lot for a family to end shelter and then come back and reapply on Monday. So they're requesting if the county would pay for the absent days like a couple times a year if a family has the opportunity to go visit relatives.
Mhm.
I can try to use some donation money to pay for that, but I can't guarantee that I'll always have that, so.
Okay. I mean, my hunch is that this doesn't come up frequently.
No, they said it's pretty rare, yeah. I wouldn't want them to miss out on seeing relatives either.
Right. Or have to go through the process
Right,
again.
right.
All right.
Depending on our spending, they'll probably later in the year will leave money available inside of it.
Oh, yeah.
Right,
Should be.
right.
Yeah.
Yeah, DSS would pay, like I shouldn't need a transfer.
Mhm.
Yeah.
Right. Any further discussion? Move to a vote.
Martini.
Aye.
Bazile.
Yes.
Broccoli absent. Mendez.
Yes.
Clapperton absent.
Hearing no no's or abstentions, the motion passes.
Thank you. And then I'd like to add a part-time temporary casework aide who's working on files, and shredding and disposing for 6 months.
Is there a motion?
So moved. A second.
Discussion? Hearing none, move to a roll call vote.
Martini.
Aye.
Bazile.
Yes.
Broccoli absent. Mendez.
Yes.
Clapperton absent.
Hearing no no's or abstentions, the motion passes.
Thank you. Okay, new hires, we had 8 new hires. Last month, caseworker, 2 account clerk typists, 2 clerks, an examiner, temporary case worker, and a part-time caseworker. Then we have 5 vacancies, a support investigator, account clerk typist, clerk, caseworker temporary, and a part-time caseworker.
Out of curiosity, how many of the vacancies are because people moved up the ladder?
1, 2. 2 of them.
Right.
Okay. Monthly motel stats, the OFO shelter is housing 4 families. Motel 88, 16 rooms. Crossroads, 22 individuals, 19 rooms. At Jeannie's, 5 rooms. Budget, 2 rooms. And then agency housing, all fun occupied.
OPD stats, there were 4 calls in the past month and one of them was a code blue housed individual.
Um. Right, any further business, questions, comments?
Okay. Thanks, happy birthday. Bye, guys.
Yeah.
Right, Director Pavlis.
Good morning.
Morning.
I would like approval's contract with Jennifer Grigioli, who is a psychiatric nurse practitioner full-time. It will be at an hourly rate of $215, and it would come out to $391,300 for the year.
Your motion,
So moved. Second.
any questions? All right, move to a roll call vote.
Martini,
Aye.
Bazil,
Yes.
Broccoli absent, Mendez,
Yes.
Clapperton absent.
Hearing no no's or abstentions, the motion passes.
Okay, thank you. Next, I would like approval to sign a service agreement with Acumed for $12,384 for a 2-year of view services only.
Your motion,
So moved. Second.
um. Remind me again what Acumed does?
So that's our legacy billing services. We closed out with them, and of course, we're in the new EMR now, but we would still have to have access for any audits or anything. We are still actually receiving payments for some of the bills that came out of Acumed.
Any questions?
Just one thing from last month, we are working on clarification of the neighborhood center contract. My office, Stephanie Lincoln, and Denise as well.
Can we vote on this real quick?
Oh, I'm sorry, wrong issue.
Wrong, yeah. Yep, let's bundle our issues.
Yeah.
I'll zip.
Please. So, where are we? We need to vote on the Acumed. Got it. How about it?
Martini,
Aye.
Bazil,
Yes.
Broccoli absent, Mendez.
Yes.
Clapperton absent.
Hearing no no's or abstentions, the motion passes. And now,
The state of play, as I understand it, is Jeanette is pulling together some kind of documentation to explain kind of what was very confusing in admin. And she will work with Denise. Stephanie is also available to help pull that together. This is kind of history stuff, so it's probably going to be gnarly to pull out, but we need to get straight the county contract and how it relates to the state funding.
and this is for the center.
The neighborhood center for the HBCI services, and I have already sent Denise and Monica as well as Stephanie the state aid paperwork that OMH provides us. So that is in their hands.
I have asked that, I mean, I have the paperwork here. It is not something that I'm familiar with, understand what it means, so I've asked Jeanette to meet. And I'm my plan was, or what I was hoping was that Jeanette could gather this information because last meeting that we had, I don't think we had a bunch of information. I'm not sure what information Jeanette had before the board, but the goal was to get as much information as she can to supply that to you all so that you can make an informed decision about how to move forward. Is that what our understanding is, Jeanette?
Yeah, I mean, yes. Well, when I did respond to your email with some dates and times I'm available to meet to go over those documents,
Yeah, I
and
guess that's.
then we can, I guess try to break it down as clear as we can to explain it.
That'd be awesome. And
Great.
we don't live and breathe contracts, on the committee. I mean, I don't. So if you can make it as.
Yeah, and I think it's not, really, I don't think it's a contracting issue, and that's why I'm leaning on Jeanette. Because I think this is more of an information documentation issue so that she can explain to the board what's going on. I don't see it as a contract issue
Okay.
yet. But we are able to help her and help you all if there's any questions that come up. Absolutely.
For your meeting,
Mhm.
you should involve, Stephanie,
Okay,
because we can relate the grant documents,
Sure.
contracting
Absolutely.
stuff
Yeah.
to the actual flow of funds.
okay. And which actually makes it, because I think that's what this tangle, I think, is more about funding and grants and less of contract. I think once we get that nailed down, the contract piece will come in, but I think we're not there yet. Is that fair, Jeanette?
Well, I think what it is the contract that has already ended. We didn't get the other half of those funds until after the fact. It was for that contract year, but as I had explained at the last committee, OMH had sent half of the money to Herkimer County and it took them a while to kind of figure that out. And then we didn't get the other half that we need to pay them until I don't have the exact date, but it was sometime in like mid to late fall of last year. And then we received those state aid papers that I sent you like I don't know if that was late December, early January, showing the money on there. So even though the contract ended, we didn't get the money until, like I said, late. We have to find a way. Do you want me to amend the contract, do a new contract just to give them those funds? The 2026 funds that we also talked about, it was states on that paper decided to do a direct contract with the neighborhood center, so we don't have to worry about that contract or those funds.
So we'll look into it. We'll meet and we can figure out what the best course of action is.
Sounds
Yes.
great. Sounds great. Okay, any other business?
I just have an FYI for the board is that I received 2 resignations for the mental health subcommittee, a Melinda Murdoch and a Jen Johnson.
Okay. Okay.
That is all I have if you don't have questions.
Anyone? All right, thank you.
All right, thank you. Have a good day.
So according to our agenda, Yvonne should be up, but she's not till 9:25. I was wondering, Elaine,
Yes, I am here. Can you hear me okay?
you sure can. Are you able
Okay,
to
great.
now?
Yes, give me just a moment here. I was also on my other laptop at the same time, so
Yeah,
let
hold
me
on.
just set up here. All right. Okay. And thanks for having me today. I appreciate it. So what I was asked to come share with you all And I am Elaine Mosher-Campoli. I am on Oneonta's City Council representing Ward 1. One of my assignments this year is working with our ad hoc committee on homelessness. And I'm also a liaison to the county board as well. So glad to see you all. And sorry I can't make it up there. So thanks for having me on Zoom. So the Ad hoc Committee on Homelessness met on February 26th, and I'm going to give you the same report that I gave to council. I think a lot of that is, or some of it is going to be redundant to some of the information that you guys already know, but I want you to know the scope of the information that I was presenting to the council. So first of all, the attendance at our ad hoc committee was from various levels of local government, Department of Social Services, nonprofit provider agencies, and religious organizations. The Oneonta Police Chief provided an update about what they are seeing in the community. But we took most of the time for providers to share updates about what they are seeing locally with food insecurity, homelessness, and the increasing number of individuals. The need for mental health and substance use services continue to increase, and that was really highlighted as well. Overall, every single provider agreed that they are seeing increases in need, a changing population that is younger and has more needs. And there was a lot of interest in 4Du's work that they are doing currently with the county sheriff and jail on a reentry program to assist with transitional coordination with DSS. The local warming station run by Catholic Charities in Oneonta is the only shelter available for adults due to the New York State regulations, with the homeless shelter run by Opportunities for Otsego only serving families. The warming station is consistently above capacity. We talked about DSS has been utilizing local motels for housing, and when those resources are exhausted, housing is sought and paid for out of the county, where DSS continues to provide those services despite the distance. All provider agencies also continue the same message that I've heard them repeat now for several years. The lack of affordable housing is a barrier to meeting local needs for housing. And more specifically, several of them said, without that, we're just spinning our wheels. Families who are supposed to stay in the shelter up to 90 days are staying a year, and sometimes as long as a year and a half, solely due to the lack of affordable housing. In order to meet these needs, again, sometimes housing is found outside the county, but this presents issues for the resource availability and continuity for the individuals and their families. The need for affordable housing is right here in the city of Oneonta, where jobs, services, and transportation is available. We also need more robust year-round services for individuals facing homelessness. The other related issue that was brought up and being discussed by the provider agencies is the lack of public support. One agency spoke up about the resources, both time and financial, needed to invest in creating new services that to support the needs, and then also pointed to the pushback that another agency like RSS is getting and noted that they just don't have the resources to expend if the public will not support the solutions offered. So at this point, I called upon the Common Council to be a leader in building the support needed to meet the challenges faced by the most vulnerable in our community. And I asked the council to commit to putting affordable housing at the forefront of our priorities. And we also went through a strategic planning process at our last meeting where I made sure to bring that up. So this committee is going to continue to meet quarterly. The goal of the committee is really at this point to provide a space where everybody can coordinate, talk about updates and help, keep this on the city's agenda and help move it forward however we can.
Thank you for looping this committee in. Has there been any discussion at the Common Council level? I know that Catholic Charities would be happy to provide more support if they had space in which to provide it. Have there been any conversations about that at the city council?
Specifically, it was Catholic Charities that specifically brought up the public pushback that they would like to, be able to engage in more services. However, they are, it's this, issue of getting through the public pushback in order to make things happen that they are citing as a barrier right now. And that they would like to. The space is an issue. The current warming station is at capacity. But they are concerned about taking on more and not being able to, in investing into, creating something new and then not being able to fulfill it if there's a lot of public pushback. So that's where I was calling on Common Council to help build that support that these nonprofits need in order to expand their services.
Right. Right. Are there any questions, comments from the committee? No.
Yeah, and I could just say, more specifically, I know that I did make sure, through our strategic planning to bring up points where council can, affect change, things like partnering with developers, making sure to keep it at the forefront of our strategic planning. They are definitely interested in specific goals. So if there's any, recommendations that this committee has that I could bring back, I'd be happy to do so.
Yeah. I mean, I think a good specific goal is finding more space, but again, I don't think
Yeah.
we can do it until. Oop, there you are. Until the community is ready to have that conversation. Like,
Mhm.
I'm sure there is space available. But I think at this point, we either have resources to provide support at a new space, or we have resources to push back or get a new space started. Like, we don't have both at this point. And I am not sure how to overcome that. So any suggestions would be anyone at all, would be welcome. But that is my take on it. Any other?
Elaine, was this meeting open to the public?
This was not generally open to the public.
Okay.
It was it was an ad hoc. Oh, I'm sorry, go ahead.
I was just wondering if you had public commenters or anything, but
We
I
did
didn't think
not.
it was. I didn't hear anything about it, so.
Okay, well, so the next meeting, so if that was end of February, would be quarterly, so May, end of
Yeah,
May.
we have not set the date yet, but I can certainly keep everybody up to date.
Please do.
Yep.
Thanks for dropping by.
Yeah, thank you for having me.
Oh,
Thank you.
thank you.
Heidi might not be there. She sent me a text that I'm on at 9:25, but we're currently having a fire drill and I have
Oh,
to leave
boy.
the building.
Oh.
And that was at 9:20, so.
Okay, well, let's wait and see. She'll be back or she won't. Or the building's actually on fire. Which,
Good. Which would be.
but let's assume it's a drill. And that they waited for a nice day to do the drill.
Yeah, we had one a couple of weeks ago with this, but
When it was still actively gross outside.
Yeah, at least they picked a nice day at the Meadows.
it was not as nice as today, but it wasn't like sleeting, snowing.
I mean, that's,
So it kind of passes for a good day.
yeah.
Oh, Heidi's back.
Yay!
We're ready.
You ready for me?
Yes.
How was your
Okay.
fire?
Perfect.
Yeah.
Okay, program updates, influenza to date for the 25-26 season, we've received 1,033 lab confirmed case reports. This compares to, at this time last year for the 24-25 season, we had received 809. So it is has been a bad flu season. We're seeing more cases of influenza B now. A typically we see in the beginning of the season, and then B becomes predominant in the second half of the season. So RSV is also increasing. We've had some hospitalizations in elderly people for RSV. So you can always still get vaccinated for influenza and RSV. We have finally had our rabies clinic set. We were able to get, we actually had good response from our Facebook post that we only had 4 scheduled. We had some vets respond to that. So we are up to 9 scheduled for the season. And I believe that's what we had last year. So we're on track with providing the same amount of clinics. And we are continuing to work with the SPCA for offering, we provide them with vaccines, so they're able to offer free rabies vaccination too. I'm thinking we just about have our annual report done, so I will be able to bring that next month to review and have copies for you guys.
Can I, real
yeah.
quick?
Yeah.
I saw on Facebook post from the department about ticks. Are we
Yeah.
starting to move into tick season?
Yes, it will. I just had a question this morning about that. I have to look up, but I'm not sure how soon after the snow melts. I mean, I'm sure they're out there. If you're out in the woods, you probably will get a tick on you. We were hoping.
Was that Alex?
Yes.
Well, if that was yesterday, he had like a bajillion.
I don't think it was yesterday. I think it's an old one.
Oh, okay.
But I'll ask him. Yeah, I think it was just to show like what to look for. Yeah. Yeah. Hoping that this winter, since we had a long stretch of under freezing temperatures, that the ticks won't be as bad this year, but that's really probably wishful thinking.
Yeah.
Okay. I have to make a correction to, and I don't know if Monica or Denise is in the room.
I'm in the room. Denise
Okay.
is
Okay. I wasn't sure how we should do this. So there was a resolution passed at the board meeting to unfund my psychologist positions, which was a mistake, really just a paperwork mistake. The funding right now, well, before this resolution sat in the contract line. It will just have to be moved to our personal service line at some point in the next few months to cover that, but it shouldn't have been unfunded.
so essentially you're seeking a resolution to fund the position that that went through the vote last month to unfund.
Yeah.
Essentially undoing what the resolution was last month.
Yeah. So I guess a resolution to fund the 2 psychologist positions.
Heidi,
Yes.
do you know if Alan took any action?
I don't think he did.
Okay, good. Good.
Because it doesn't say how much or anything in the resolution, and he never asked me like how much to remove, so I don't think he did.
And if I could just also, I don't know if we're at discussions yet, but okay. So if I remember correctly, there were 2 resolutions. One was to create, fund, and fill the 2 positions, and then one was to unfund an expenditure because that position was not a county position. So what you're seeking to do today is fund that position, the expenditure that we unfunded.
Yes.
So it's not having anything to do with the 2 psychologists, or it is simply funding. And if I misuse the term of who they are, I apologize. But it's simply funding that. I can't remember what the name of that position was. Do you remember what it was, Heidi?
It was psychologist, school psychologist.
Oh, okay. So there's one school psychologist that's being funded. And that's a contracted position, not a county position.
Yeah, there's actually two. Yeah, there's we have two right now. Well, prior to the resolutions last week or this week, we had two contracted psychologist positions. Per state ed department, we had to make them employees. So they are part-time by resolution now, part-time employees. So they're already funded in the budget. The funding won't change. So yeah, I guess I just have to refund the contracted school psychologist position that the resolution unfunded this week. It's confusing, I know, apologies.
As long as that makes sense to you guys.
Yeah, I think the way James explained it is accurate.
Okay. Okay, moving on.
Do we need a vote? Do you need a vote on that?
Yes, we do, sorry. Is there a motion?
So moved. Second.
Okay. We had some discussion, moving to a roll call vote.
Martini,
Aye.
Bazil,
Yes.
Broccoli absent, Mendez.
Yes.
Pepperton absent.
Okay, hearing no no's or abstentions, the motion passes.
Thank you. And then really, I just wanted to follow up on the coroners like we did, we did the resolution. That's all set. I'll work with Carol to get, access to their accounts and everything and learn what I need to know from her. But I was wondering how I should proceed with the coroners, if you guys have had a conversation with them, if I should draft a, correspondence to them and let you review it, or didn't know who it should come from, if it should come from Steve or the chair or me or Carol.
Gosh, that's a great question. Why don't you draft something and send it to Steve and I?
Okay. Will do.
Maybe like the letter should be a joint letter from Carol and like Heidi, like switching. I don't know, you guys.
Okay.
I was just thinking like, Carol's moving on from this and Heidi's gonna be the one doing it. Whatever.
Although really it was a board.
Right, decision, yeah. So
Board decision.
yeah.
Yeah. All right. Well, I'll draft something and then you guys
Yeah.
can work, change it however you want and decide who it should come from, you and Steve or Adrian and Steve or whoever.
It's a letterhead problem in the end.
Yeah, it's not a messaging problem. It's
Yeah.
we'll figure it out. But
Okay.
if just
I'll send a draft.
yeah, and just make sure you have all your contact stuff, and as long as they know where their supplies are and that kind of thing,
Yep.
it shouldn't be a huge transition.
Sounds good. Okay. That is all I had.
Okay. Any questions for?
I was just gonna add something in about the rabies. Heidi and I talked about that earlier, but I wasn't at the board meeting last month, but I do know that Stacy and Dr. Lukoski came to the board meeting, Heidi, and the shelter has a new mobile van to do clinics and transports and stuff.
Yep.
So if in any of like your work, of like neighborhoods or area of the county that could like benefit from those services, the van is gonna start going directly to those places.
Okay.
So to reach out to Stacy and let her know where you think a need is for
Okay.
those services,
Okay.
like basic wellness clinic, vaccines, more than just rabies, so.
Yeah. Okay. Maybe we can partner and they can come to like set it up at our rabies clinics or something.
Yeah. Yeah.
Yeah. Okay. I will reach out to her.
Alrighty.
Thank you. Thank you.
Bye.
Thanks.
Bye-bye.
Is there any other business before this committee? Motion to adjourn would be awesome.
So moved.
Second.
All right, we are adjourned.
I've discovered.
Recording stopped.